Wes, thank you so much for taking time out. Really appreciate it.
No, thanks for having me.
Is Wes appropriate? I feel like I should have
What else
more.
would you say? I've been called Wes.
I'm really curious. Who were you beyond all of your roles? Because I think like that when we met the last time very briefly, I get a warmth for humanness to you. I can feel the East Londonness in you and the Arsenal fan in you. I can feel it. But like, who are you when you're just not on working?
Like, it's definitely like the exception now, because most of the time I am to some degree working or like switched on to work. Even like I find, cause I live slap bang in the middle of my constituency, so even at the weekend when I'm out and about, people will kind of stop and have a chat in the supermarket or in the cafe or in the pub, which on lots of levels is really nice. And like the way I look at it, I spend a lot of time on Saturday mornings knocking on people's doors and interrupting them. So if someone sort of wants to stop and have a chat in the supermarket, I can hardly complain. And it's nice. I like the fact that people feel that they can approach me and can have a conversation. Yeah, it's funny. I don't really feel like I've changed as a person. I think I'm very similar to the person I've kind of always been. Obviously, we all grow, we all mature, we all learn from our mistakes. But I'm still, you know, politics hasn't changed me in that sense.
That's good to hear.
Yeah, I feel grounded as well. You know, I come like for all the cynicism about politics and politicians. There are lots of us in Parliament now, increasingly, who come from what I would describe as either a normal background or working class background. I mean, my background I wouldn't exactly say is normal. I had to write a book about my childhood because it involves a couple of grandparents who were in prison, growing up in poverty. So to that extent, I am not a typical politician in that sense. And those experiences stay with you. So I think it definitely helps to keep me grounded. It means that when people I represent come to talk to me about their housing situations or, you know, if they're struggling with various things, I identify with that and understand where they're coming from, even if their experiences aren't quite the same as mine. Yeah.
There's also an interesting jeopardy, the fact that in 2021, you had your own cancer challenges. Do people know that? Is that understood? Because that's quite a big deal. But then also now the role that you actually play, is there something that you learned from when you went through it that you've taken into the work that you're doing now?
Yeah, don't waste time. You know, I feel very, very lucky. And I felt lucky when I had my cancer diagnosis, which is a really strange thing to say. But the only reason, because I had kidney cancer, and the only reason it was diagnosed was because I had kidney stones. So I ended up in A&E in excruciating pain in my back. And it's only because they scanned for that and found the kidney stones that they found the kidney cancer. Otherwise, you know, who knows where I would have been, and that cancer would have ultimately grown, metastasized, spread. And again, I was very lucky. I just had surgery. They whipped one of my kidneys out. And compared to kind of friends of mine or family of mine who've gone through or are going through cancer, I think I really had it easy. And I remember just thinking, although on one level it's very unlucky to have cancer, you know, at the age of 38, which when I was diagnosed, I also thought it could have been so much worse, and I've got nothing to complain about. And that plus, you know, my near-death experience at the ballot box at the last election, where I kind of scraped in with a very small majority, I just feel like blessed, to be honest, you know, that I've got a massive opportunity to make a difference. Don't waste time, don't waste a day of it. You know, do all you can for the National Health Service, because I wouldn't be here today without the NHS. So it means a lot to me.
You say that candidly, but that's a very real thing, right? Many people after becoming MPs get kind of stuck in who are you now and what do you do now? I remember some of the Tory MPs struggled to find work after their terms. Do you ever think in that kind of way, or is it just sticking to the job?
I think you have to just take each day as it comes. And politics it's really interesting. When I talk to people in very different professions, like it there's a similar jeopardy in politics. You know, if you're voted out, you get your 3 months severance pay, and then you're on your own. And you're right. I mean, there was a huge number of Tories who lost their seats at the last election. We worked. Why are you laughing? That's harsh.
I think I'm allowed to laugh at that. I was there. I was an adult. I saw it. Go on.
But you know, and look, obviously, I worked really hard to make that happen. But yeah, there were quite a lot of them. I saw a former Conservative MP on the train the other week, and they were saying how many Tory MPs have struggled. So, and it's a bit like, you know, you can be, you know, you've got to work really hard to get into it and to get elected in the first place. There are a lot of people in creative industries, sport, have a very similar experience where one minute you might, you know, remember Heather off EastEnders, I was really struck by what she was saying. Like, 1 minute there she is on our screens, one of the biggest primetime programs. Well. Yeah, really loved character. People really connected with her and liked her. And then she's on social media talking about how hard her life has been, and she's in the newspapers because she's ended up having to rely on the benefit system because she's not been able to find work. And it's, you know, I mean, my family have been through that. Some of them still go through it. So I know I'll be all right, whatever happens beyond politics, but you just got to focus on what can you do with the opportunity you have in front of you. I also spent most of the first, you know, I mean, I've been in for nearly 11 years now. Most of that time was spent in opposition. And
it's more fun in opposition.
Oh no, it's really not. It's really not. It's easy. Like, it's much easier in lots of respects.
So I have a theory, right, that being in opposition is just like throwing things at a wall.
Yeah, you
and
basically
just saying whatever you want.
See what sticks.
Your
and
job
you
is to
just turn
destroy
up,
things. Yeah,
you slag off the government. So I wouldn't have done it like that. And then when you're in government, you have to do it, and you have to do it well. You have to do it to the best of your ability, and you have to take brickbats from people. Sometimes the criticisms are fair. A lot of the time, you know, especially now we're not even 2 years in, we get quite a lot of, well, this is still a problem, that's still a problem, the other's still a problem, and I accept all of that. And I'm always trying to get this balance right between, on one hand, reporting back on what we've been doing and giving people a bit of hope and confidence that things are moving in the right direction on the NHS, at the same time as acknowledging that while waiting lists at their lowest point in 3 years, ambulances are arriving faster now than when I became health secretary, patient satisfaction with access to GP have gone up. I've got trolleys on hospital corridors, which I think are a disgrace. I've got people still waiting far too long for treatment. Dentistry is really hard to access in lots of parts of the country. Mental health waits are way too long. So there's a whole massive list of things that I can reel off that are still big problems. But, you know, we mustn't let the country slide into cynicism and fatalism and a belief that things can't get better. Things are getting better in the NHS. It will take time. We always knew it was going to take time. To be honest, I think most people know that. What I don't think people necessarily are hearing yet or feeling is that the NHS is moving in the right direction. But there's a lot more to do. I'll be the first to say that.
Yeah. You're trying to save 20,000 more lives. Is that correct in terms of a goal or through the
National Cancer Plan, yeah.
And there is a will there. There's maybe a desire you have, a personal desire based on your lived experience, but then you are not the end all of that being happening. As you said, there are trolleys in the corridors right now. You can't just go into the corridor and be like, move this, what's going on, and fix it. It requires you to change policy, but then that has to be implemented.
Yeah.
What's the hidden part of the process that people don't understand? Because it's just anything in health, we come to you, you're meant to have an answer and a fix immediately. What's the hidden chain that you know there is more things that it takes to deliver the things that you genuinely want to happen?
So there are hundreds of NHS trusts and provider organisations across the country who are key to delivery. So I've got to mobilise a team of 1.5 million people in the NHS to deliver what we need them to. That means giving clear direction, giving them the tools to do the job, and making sure you've got the right leadership and management in place to drive change. And, you know, there are some things that are, you know, going well on cancer, like we've hit the faster diagnosis standard. So this is people who get either a diagnosis or the all clear within 28 days.
Wow.
And, you know, we've already, through doing that, you know, over 100,000 people have ended up getting a cancer diagnosis or the all clear much faster they would have done.
So does that
more
frustrate you,
than what we inherited.
The fact that that's a big headline. 100,000 people have been diagnosed within 28 days, more than previously before, and that headline probably won't exist in any major newspaper. It'll probably be it would be brushed over.
No, one of the challenges
does that frustrate you?
Oh, massively, but also partly because, you know, the media landscape is changing, and now like people don't watch the BBC News in the way they used to. They don't even read newspapers in the way they used to. And the key to getting attention online is often outrage and controversy. So we're constantly
We'll figure out something to say between us at the end.
We're constantly being, drop the F-bomb or something. But like, you know, we're constantly being fed this diet of like bad news, and we consume it. And it's chicken and egg. It's partly what we're fed. It's partly the fact that the media are responding to what we consume. And so a headline that says great news on cancer is not going to get as much attention as government fails to meet cancer waiting times standards. So that's the challenge we're in. But I always feel like complaining about the media as a politician is a bit like being English and complaining about the weather. It's just how the country is. And we have to overcome that, you know, and come up with smarter ways of getting our message across.
Yeah. What's the meat on the bones on the cancer plan then? What would somebody at home hear it and be like, right, this is great for us?
Yeah, so fundamentally, it is about making sure that we have got much faster access to diagnostics. We've got, you know, new screening options and new treatments coming online all the time at the moment. I feel quite optimistic about cancer. I mean, just last week, I was up in Edinburgh University, looking at what they're doing in terms of cancer treatment and on brain cancer, which is like one of the hardest cancers to treat. And, you know, there are lots of brain cancers that, you know, have a, you know, 0 survival rate ultimately, especially some of the childhood ones. And they're trialing some new treatments that are really encouraging in terms of initial signs. So we're constantly going to see that improve. But fundamentally, why have we got some of the worst cancer outcomes in Europe? It's because we diagnose too late, therefore we start treatment too late, and therefore survival rates are much worse. And that is a thing we've got to try and turn on its head. And one of the things that we're really driving at with the 10-year plan is also making sure that there is equal access to diagnostics and treatment, because we've got massive health inequalities in this country. And so not only are we're losing the kind of cancer lottery of life in this country, but you are more likely to lose that fight and that lottery if you are poorer, if you're black. You know, there are massive health inequalities built in.
Yeah. There's a part of me that feels like, how far do you go in terms of changing policy around cancer? Because the causes of cancer have been things like food, nutrition. And I think nutrition education in this country is very poor.
Yeah.
When I do Jeremy Vine, it comes up all the time. Most people don't know what the right foods are to be eating. Yeah. Is that a part of the strategy also? Is it to like go down?
Yeah, so a lot of stuff on,
healthier?
Yeah, exactly. A lot of stuff on prevention. We've just about to get the tobacco and vapes bill passed into law, and that will create the first ever smoke-free generation. It means kids growing up in the countries, they will never legally be able to buy cigarettes. We're clamping down on some of the vaping and the marketing of kids, flavours, all sorts of factors that have turned vaping from a stop smoking tool into a new consumer nicotine tool that's particularly targeted at kids. So we're trying to clamp down on that. We're banning the marketing of junk food to kids. So trying to get into some of these causal factors of cancer as well, so that we are being healthier, more active. You know, that helps to reduce the risk, doesn't eliminate the risk. And in the last kind of 6 months or so, I've met some very healthy people who've had lung cancer, for example, and other cancers. So you know, there are other kind of contextual factors, risk factors, but we've got to try and attack the causes as well as the symptoms. If
you were talking about from a health perspective, we are, you know, the next election's coming out. We're talking about how amazing we've done in health. What's the headlines that you would like to be able to say by the end of this parliament going into the next election? Well, fundamentally, the test for as far as I'm concerned, the test for any politician is, are things better now than I inherited them? Like, have I moved things in the right direction? And by the next general election, I want us to have cut waiting times from the 18 months I inherited to the 18 weeks NHS standard.
I want to make sure that ambulances are arriving faster, people can get a GP appointment when they need one, for all of those things to improve. Where I really want us to be is in a position where, like, you know, from a patient experience, I can knock on the door, and when they're doing the sort of, you know, version of what have the Romans ever done for us, and say, what's your bloody Labour government done for me? And I can say, well, get your phone out, look at that NHS app, look at the way you can book appointments in the way you couldn't before, look at the new features for your health that are available that weren't available before. If people do need diagnostic tests and scans, making sure that they don't have to take time off work. There are more out of hours, like before and after work appointments available, maybe at your local community diagnostic centre. Making sure that, you know, the new NHS online service, if you're, you know, worried about something, your GP might say, actually can access a specialist via NHS online. People might think, yeah, I'll do that, get waiting list down. So I think the ease and convenience of the NHS should be a lot better, and waiting times should have improved, whether that's for planned treatment, ambulances turning up, trying to, you know, making sure we don't have all these trolleys on corridors anymore.
Yeah, I think men is a big deal for me. So I have a men's circle, I have Dog Black Dads. Men are a huge focus for me. How do we actually come up with real strategies for men that have real impact? Because when I talk to men, they'll tell me that I want to live for my children, I want to live, but they never talk about living for themselves. There's a lot of ideas around men that I think are a little bit archaic, and they struggle to advocate for themselves, really, especially around health.
I think that's right. I was really proud that we launched our first ever strategy for men and boys. And if I think back to when I first became an MP, and there were arguments around, you know, should we have an International Men's Day debate?
Yeah.
And I remember, and I'll be honest, I was one of those people thinking, like, why do we need an International Men's Day debate? Like, it's an everyday International Men's Day. We still live in a society that is fundamentally built around men. We've got real problems with sexism, misogyny. In the grand scheme of things, what have we got to worry about? And actually, the more I've listened and reflected over the last 10 years, the more I've thought, this isn't about men versus women, and we've got some really serious challenges to address, whether that's for young men growing up in this country today, where we've got real educational divides, particularly between rich and poor. And, you know, I come from a very white working class family. We're at the wrong end of all the statistics. But you look across ethnicities, there are real inequalities between the sexes, also between people of different ethnic backgrounds. So we should get into that. Men's mental health, I think, has not been taken seriously enough. And one of the statistics that really stopped me in my tracks was that suicide is, you know, the biggest killer of younger men. And I just thought, how is that even possible? Like, and how have we not taken this seriously enough? And we do know that, you know, while this still is a broadly patriarchal society in lots of ways, there are also ways in which that also rebounds on us, ironically. Yeah. And we don't open up so much. We don't talk to each other and with our friends and about our feelings in the way that lots of women do. And that is really unhealthy, actually. And, you know, I think we are getting to a better place of talking about different types of masculinity and what it means to be a man. We've got to be really careful that we don't end up making some men feel like, because they're what might have been called in, you know, back in the day, sort of a man's man and very masculine, very like, you know, traditional male stereotype. Can't like demonize blokes just for being who they are.
Yeah. Who do you get to speak to? Because I work 60 hours a week. I'm always shattered. But I tell people all the time I have 20, 30 systems to get through every single stage of my week. But I suppose, can you be that open and vulnerable? Does that work in the job that you do? Do people...
In different contexts, I'm very lucky. I've got lots of people around me who are very supportive. I work with brilliant teams of people in politics. It's not an environment that's kind of famous for team working. And there is a bit of, you know, everyone out for themselves to an extent in our political system. And the way it's set up, it almost kind of creates competition between politicians. But I've got a very, very good team around me of good people. And I certainly feel comfortable kind of, you know, opening up and saying, look, this is going on at home, or like this is happening in my family, or I'm just feeling like a bit overwhelmed at the moment. So, you know, and that is important in a high pressure environment, and I also feel a responsibility to kind of lead in a way that creates that space for other people as well. You know, people perform better when they can be themselves, and that includes being able to say, I'm struggling with this, or do you know what, I've not managed to get a piece of work done in time because this is going on. And I think just understanding that is really important. And I've got people in my life, you know, my family, you know, who I talk to a lot.
That's good. There is I want to quickly talk about sickle cell very quickly, because there was a sickle cell ward that was at the risk of closing down. It seems like it's staying open, and it impacts Black people more than ever. So I think for my community specifically, it's a massive, massive deal. What commitment can you make in terms of sickle cell or the ward specifically, or just to work and investigating more about it to make sure the education is there?
Yeah, so I think a few things. One is, you know, sickle cell is one of, if not the fastest growing genetic condition in this country, and it needs a lot more focus than it's had. There have been some good breakthroughs in terms of diagnostics and treatment, but there's more to do in this area. I think the challenge with the Mile End controversy, I mean, they've reached the right decision ultimately, so it's not closing, and I think that is a good thing. I was really pleased to see that.
Do you make a call as like, hey, this is terrible news, what are we doing, what's going on?
I try not to wade in, partly because I'm trying to stop sort of that top-down micromanagement. But yeah, I will kind of go, if I think that something is going really badly wrong, I will just kind of go in and say, I really think you need to think twice about this. I mean, in this case, they got to that conclusion without my intervention, and I was really pleased. My worry about it is in the process of reaching the right decision, the message that would have sent to Black communities. Because if there's one thing I've been really struck by in various conversations I've had in this building, whether it was around prostate cancer screening, whether it's about the men and boys strategy, you know, and you know, some of the other plans we put together where I've had conversations with people, particularly through a race lens, we've got a real problem in terms of the relationship between the NHS and Black communities. And there is such a lack of trust, which when you think about it is perverse when you know, beyond the fact that the NHS should be there for everyone and everyone should feel it is there for them. Like, Black people have been in the NHS since the start. You know, that Windrush generation helped to build the National Health Service. And so for a service that's always had diversity at its centre to have failed so badly, and you know, I think there's lots of issues for the NHS to get into that I'm, you know, getting us into in terms of the experiences of different patient groups and health inequalities, including Black communities, but also if you look at our staff, career progression, senior leadership, who's sat around the board table, who are the executive leaders in the NHS. You know, this is an organisation that's had a very, very strong pipeline of Black talent since 1948. So it doesn't have the same, I mean, I was about to say same excuse as others. I mean, we're third decade in the 21st century, and I think the excuses really have run out for across the board. But for the NHS in particular, the nature of its mission, the nature of its values, the fact that Black people have been in it since the start, it kind of does make you question, well then, where are our Black leaders? Why is there a kind of a cap on aspiration and progression for Black people in the NHS? And that's just working in the NHS. But I think that for me, diversity and inclusion, it isn't a tick box thing. It's about making ourselves feel better because we're like, you know, we've got everyone around the table and haven't we done a good job? It's actually about, if you've got different perspectives, different points of view, different experience around the table, you're more likely to make decisions that benefit everyone. And that is a real challenge, I think, for NHS and wider society. But I think with the NHS, this is a life and death difference. And at a time when equalities as an agenda is under attack, I think there's an opportunity for us to show in the NHS why actually it really matters, not for tokenism, but for making a real difference and a real impact and serving everyone fairly and equally.
So it's International Women's Month. I'm going to dedicate a lot of space in our platforms to women to tell their stories and what their experiences are. I know maternity health is
Yeah.
still a massive problem, specifically Black maternity health seems
Yeah.
to be an ongoing issue. Are there any commitments or focuses in those particular areas that we think is really important to tell those people? Because to be really honest, when I went through that period myself and my 2 children were born, the mother of my children was just going through it, and I had to sit there and observe it with fear and a complete lack of knowledge about what was going to happen on the other side. And I know a lot of dads, for them, that's the first time they are fully out of control, and they hand their loved one to a system that may not necessarily see them. So what are some of the things that are happening in that area?
Yeah, I think the first thing I'd say is dads are a really important part of the conversation as well. And it's come across so strongly. I mean, I've spent loads of time over the last year, particularly with victims of the NHS and some of the worst scandals in maternity and neonatal services. And every mother says the same pretty much, which is, don't forget partners in this as well. They're really important. And often when the family has gone through a real ordeal, whether that's, you know, the mother being seriously injured or losing a baby, and a baby dying avoidably in the care of the NHS, often the dads feel like they have to carry it all. And, you know, I mean, I don't think we do a good enough job for mothers and babies, but in some cases we do no job at all for the dads, and that's not good. We need to see the whole family. We are, at the moment, been rolling out some funding and improvements to services, but I've asked Valerie Amos to do a rapid national investigation, which will report in June, into maternity and neonatal services that will get into all of these issues and give us a clear action plan that a task force will drive, which I will lead personally, with a good cross-section of experts around the table, including families. There is such a strong race dimension to this as well. We know from brilliant organisations like 5 Times More that Black women are more likely to die in childbirth than white women. The numbers have been reducing in terms of the gap, but not for good reasons, often because more white women are dying in childbirth, so we've got a lot to focus on. And I've been picking up some anecdotal evidence about data capture as well, which suggests that the data might not be fully reporting the extent of babies dying and mums dying, and capturing accurately the race of mums and babies. So we've got to, but regardless, we do know that this is a challenge, and we know that some of the risk factors are not being properly explained to parents in advance. We're not showing the level of curiosity that we need to during pregnancy to keep an eye on those risk factors. And we also know that in some cases there have just been some really shocking examples of racism, including, you know, one woman saying, well, when I wasn't given pain relief, I was told, well, I assumed you're a strong Black woman. I mean, what?
That is very common, yeah.
Yeah, and that's the thing. These aren't like one-offs. These are common experiences. And one of the meetings that really broke my heart was a couple from South London that had a baby at their local hospital, and the baby died, and it was avoidable, and there are risk factors that should have been picked up. And then the thing that broke me, just emotionally broke me, was then they described going to one of our best hospitals and having an absolutely brilliant experience and a safe delivery of the baby. And the thing that kind of broke me about it was I just thought, like, this just one couple have shown, like, the difference between the NHS getting it right and not getting it right. Yeah. And there was no reason why that first baby shouldn't have survived. And I cannot imagine the ordeal those parents have been through. And so we've got to do a lot better on education, culture, practice, but making sure that both staff and parents are educated on risk factors. The staff should know first and foremost, and then staff should share that with parents, not to frighten them or to make them anxious, but so that they know what the risk factors are They have confidence that those factors have been identified and they're being supported. And then, you know, God forbid something is going wrong during the pregnancy or, you know, during the delivery, the parents will, you know to raise that alarm and not to take no for an answer. And, you know, if there are kind of symptoms during the pregnancy that don't feel right, err on the side of caution. Whereas, you know, often, you know, the words that always strike fear into my heart is when people say they don't want to be a burden on the NHS. It's like, oh, no, don't take that attitude. If something's wrong, something doesn't feel right, go and we'll be there for you. Might not be there quick enough sometimes, but we'll be there for you. So I think there's a lot for us to get into around this, because some of it is structural racism, some of it is direct discrimination and racism, but the outcomes are just completely unjustifiable, and I want to make sure we keep that sharp focus on it. And we've got some brilliant MPs campaigning on maternity. I mean, Belle Ribiera-Addy, the MP for, well, I'm not sure she's the MP for Streatham now, a constituency name. I think it's like Brixton Hill, I think. She'll kill me for not remembering a constituency name. But
we'll apologise, don't we?
Bell's been brilliant on this, and she's spoken so openly about her own experiences as well, really bravely. So we've got good MPs that are going to hold my feet to the fire as well to make sure we deliver. And
just finally, the culturally competent healthcare that you're attempting to put in place, is it significantly harder when every time you talk about something through a racialized lens, it's like reform, restore, and then GB News are all going to come on, jump on it, take it out of context, and it becomes a negative story? Does that impact the ability to deliver such care? Because I would say in our communities, we feel like every time something is for us, which is appropriate, it always feels like it gets lost in this sort of political fight, and then it ends up being watered down or not delivered at all.
Yeah, I think we just have to take that on. And I think probably I've just got so much evidence in my corner. And this isn't, as I said earlier, this isn't about ticking some boxes in the way that, you know, some of the opponents of equality and diversity and inclusion would say. This is about life and death. This is about preventing harm or allowing harm. And you know, I would defy anyone. I mean, I found, before the general election, I did an interview with the Daily Mail on this. And look, the Daily Mail has not always been the biggest kind of champion of equality and inclusion. And what was fascinating is like, the reader comments were just like, this is absolutely right. This is totally shocking. I think people worry about tokenism. But when you confront people with some of the stark health inequalities in this country, I think you take the majority of people with you. And as for that minority of people who just don't want any focus on this, well, that's too bad. And we have got, like, I think we've got to kind of say it as it is, we have got a real problem with racism in this country of a type I have not seen in my lifetime, actually, with like the level of like what I'd describe as like open, like unabashed, unashamed, confident racism, where people are being abused on the street or abused online, and people being able to say things they couldn't necessarily have said 10 years ago. And we've got responsibility to call it out. And when it comes to challenging racism, it can't just be left to people who look like you. It's got to be people who look like me as well. And I feel very strongly like, you know, the people who make me worry most are bystanders. You know, it's time for the silent majority to speak up. Majority of people in this country are decent, kind, inclusive, proud of this country. Like, do not start crying into their cornflakes when they see black and Asian people on telly, as one of the Reform MPs was kicking off about, like, you know, offended that there were so many like black and brown people on. That's like, get a life.
That was a bad week on TV.
Get a life. It's like, are you kidding? Like, oh, it just drives me mad. And I felt like this country was moving in the right direction. And I also don't think this country is fundamentally different to how it was 10 years ago. But we've allowed, bystanders have allowed like that kind of racism to be resurgent, and we've got to put a lid back on it. And the only way to do that is to call it out and challenging it, and to be confident as we do so. And that is my responsibility as the Health Secretary.
Brilliant. Wes, thank you very much. I
very
very
nice
much appreciate
to talk to
you. You too. It was great.